Let's bring in Cantor Fitzgerald analyst Louise Chen, who tracks both J&J and Pfizer. Louise, you've heard what Meg and I have just been talking about. Is there anything you would like to add here that would be specifically referential to Johnson & Johnson, say?
Yeah, I think what I would like to add here is that from the perspective of Johnson & Johnson and from in the perspective of the vaccine rollout, I don't think this should impact things. I mean, you heard Dr. Fauci say days and weeks potentially to resolve things. And if we follow the example that we saw with AstraZeneca's vaccine in the EU, they updated the label and then they continued the rollout and said proceed with caution here. So I think, and then they continued the rollout and said proceed with caution here. So I think those are the kind of things that I would think about here. And then in terms of J&J particularly, I think the thought would be 4 things that I would be thinking about. Will the headlines become a headwind for the vaccination effort? I think we answered that. I think probably not. Secondly, what other additional data could we see come out over the next couple of weeks? And then what does this mean for BLA, a full BLA filing for J&J's vaccine? And lastly, what does this mean for mRNA vaccines that Pfizer, BioNTech, Moderna have over the adenovirus platform that we see in J&J and AstraZeneca?
Well, that's what we were just talking about with Meg. Let's talk a little bit specifically about J&J and their manufacturing problems at that Baltimore facility where there were problems that crept in there. Is that, to your knowledge, the main or the only place that they manufacture this vaccine? Why don't I ask you first, Ms. Chen?
Yeah, I'm actually not certain if that's the only place they manufacture that vaccine.
Meg, do you know?
But I do know that that facility's been in the headlines quite a bit.
Yeah. Meg, do you know?
Well, we understand that for supplying the United States, they need that facility to be authorized by the FDA in order to release many doses that they've already manufactured there and to supply the U.S. I also am with Louise where I don't know precisely if they have another facility in the U.S. making drug substance, but they were supplying the U.S. from a European facility and up until they got the green light for this plant. And so they really need this plant to be brought on board in order to be able to supply at the numbers they had planned to here in the U.S.
Louise, if I own Johnson & Johnson stock, should I own it today, hold it, sell it? What?
Yeah, I think you should own it. I think this is not something that's insurmountable. I think this is something that's been done by the FDA and CDC to increase confidence in the American population about the vaccines. I feel better as a citizen knowing that if there's any sort of issues, that the government will address it right away. So my view of it is I think that they'll probably be back online with the vaccine rollout in days or weeks, as Dr. Fauci said, with an updated label. And then the only thing that needs to really be determined is that if certain people should be contraindicated in some of those high-risk groups. And that's my take. And Johnson & Johnson is so much more than just the vaccine that it's putting out there.
Well, it certainly is, and this is obviously a major global company, and the global rollout of this vaccine was really an important part of it, not just in the U.S. Meg, let me turn back to you on the question of vaccine hesitancy that Louise was just referring to there, and that Jeff Zients and Dr. Fauci said, hey, you should look at this because the tripwire was tripped. This should reinforce your sense of security in getting a vaccine. True, or may there be people who say, doggone it, I was right. I should never have gotten it, or I won't ever get it because they're having these problems.
You know, I think there's a lot of fragmentation in the way people think about vaccines. We dug into an issue around hesitancy last week, and speaking with folks, there are some people who are not going to want to get vaccines no matter what the information is. And we have been hearing from people today that this information, and we knew that the stories about AstraZeneca in Europe were the same. These are getting shared widely among anti-vaccine groups. And there could be some hesitancy that then seeps over into the people who are kind of in the middle, who are saying, I'm going to wait and see. But I think Louise makes a great point, and it's one Dr. Fauci is making too, that there is a reminder here that there are safety mechanisms in place to quickly act when there is a signal. And for some folks, if they look at it that way, it really is reassuring about our systems here.
Louise, you follow Pfizer as well. What implication is there, if any, from the fact that the J&J vaccine is off the market, at least temporarily? What implication is there, if any, for Pfizer's success as a stock and as the vaccine provider?
So thanks for that question. I think for Pfizer, it doesn't really change anything for Pfizer in my mind. We like Pfizer. We think they've done a great job with the rollout. They've said that by the end of the year, they'll get to about 2.5 billion doses. So if for any reason there's a longer pause than anticipated for J&J, I think they can step in here and fill those shoes. They said by the end of July, they'll be able to supply the 300 million contracted doses to the U.S. government. So I think everything is all set from that perspective. And they've also started to develop vaccines looking at cohorts of younger children and also a booster for variants. So I think it's all green lights here and, positive, but doesn't really change anything for Pfizer in my mind.
Louise Chen.